Okay, so Todd, thank you for joining us today. Do we have your permission to record this interview?
Yes, you do.
Thank you. If anybody else doesn't want to be recorded, you are free to leave.
All right, thank you.
So, GCSU team, why don't you introduce yourselves? Why don't we start with Corey?
All right, nice meeting you, Todd. I definitely want to thank you for doing this with us. It means a lot to us. Have somebody of your caliber spend your time with us. But I am a new to IT type of guy. I'm a manager of a help desk, IT help desk. I probably started doing IT around the 2018, 2019 period. I'm getting to the point where I feel like I'm plateauing in the role, so I want to try to expand my skill set a little more, which led me to starting my MMIS degree. But I'm 37 with a wife and 2 kids and 2 dogs. So that's about the sum of my life right now, man. I know it's not nearly as interesting as yours, though.
Well, I don't know. That sounds like a pretty fun, exciting life to me.
It can be.
Are you from Atlanta?
I'm from Savannah, actually, born and raised. I spent a little time in the military, so I've gone to California, Louisiana, I've been to Kentucky, I've been to South Korea. I mean, I've gotten a little travel. But yeah, like I said, my life not is nearly as interesting, man. Like at least you still have hair on your head. I lost all my hair. That's how my adventures ended up. So,
Benny?
Hi, it's nice meeting you. My name is Benita Podel. I'm currently working in a banking institution with a Peachy State Federal Credit Union right now. And I wanted to gain more skills in IT, and that's how I joined MMIS program with GCSU. And yep, I'm just starting my life here in United States, learning every day, and yeah, hoping to learn more from you. Thank you.
Awesome.
Hey, my name is Trey. Nice to meet you. Trey Forbes. Recently just graduated college with my undergrad in MIS and a minor in computer science, and just started my master's. I'm 22, just started my life, just looking to learn more new things.
Awesome.
And I'm Scott Downs. I work for Meritive. I live in East Georgia and 62 years old, 4 kids, 1 dog, 4 cats. And I'm in the MMIS program with the rest of these folks. So anyway, Todd?
So, can you tell us a little bit about yourself, perhaps your professional career, history, and your personal interests and hobbies, so we can know a little bit more about you?
Yeah, let's start with the hobbies because that's easy. So I like to golf and boat whenever I'm not on a computer. I've spent 35 years in healthcare data analytics. Started off on the market research side, which most people would equate to data science. Today has led a provider organization, Jewish Hospital in Louisville. Then got hired by this little company in Nashville called HCA. Where I was director of interactive, started working when the internet was formed in '95, and worked with the organization to create their internet intranet strategies. From there, had a series of companies for the last 25 years, startup companies in healthcare data and analytics. Most recently, sold my last company, Perception Health, to Huron, where we were managing about 40 billion medical records, and built a platform for hospitals to be able to see their physician referral operational analytics to help them gain a competitive advantage.
You have a lot of experience. What got you what inspired you to start a subscription service like SANAXS?
The issue that I keep seeing in America in particular is the lack of connecting the dots in the healthcare space. And so there's a tremendous amount of data and information that's available, but very few people know how to extract the insights of that information out to be able to leverage it in their businesses. And so spent most of my career trying to unlock massive data sets and boil them down to simple insights.
Got you. Can you tell us about the data set you want to share and why do you think it interesting?
Yeah, there's two components of it. There's a provider of service file, which is a analytical file of every healthcare provider in the United States that does any kind of billing for Medicare or Medicaid. The second data set is a cost data set called the HCRIS, Hospital Cost Reporting Information System. It connects to the provider of service by a unique ID called MPI, National Provider Identification Number. And those two data sets together sort of give you the view of the world of who's providing what, who has what assets in terms of beds, in terms of emergency departments, radiology suites, surgery suites, and allows you to see what needs there are in a community from a health needs perspective, but then also who's doing a better job performing, who's driving higher profitability, lower profitability, what their charges are compared to each other. And so you have two data sets that when they're combined sort of give you a picture of what the providers are doing in their local communities.
Gotcha. How sensitive is the data? Would I be able to train an AI model on it if that's possible?
As long as you're in the United States, you could use it for that particular purpose. They get a little sensitive on elements of the data when it goes outside of the US, not that you couldn't use it, but there's these data sets. If we go to the next logical data set after these, then you would have to have a background check and some other elements in place before you use that data.
So could we follow up on that and maybe get a list of the restrictions on the use of the data?
Yeah. For the
Okay.
ones that I've shared with you so far, the provider of service and cost report information, as long as you're using it in the United States, you're fine to do whatever you want to with it. It's the next level that you would have to be a little more careful with the data. And as part of that access, you'd have to sign a release. But yeah, I can send that to you.
Okay, great.
Some good info. So based off the type of data that you've provided in the use cases, like what is your ideal target audience for this type of data? Like, is it gonna be like some engineers, programmers, or is it like the hospital themselves? Like, who do you expect to get the system once it's created?
Well, you ask a really astute question there. Because this data is multifaceted, IT individuals would want to use it in order to build models on top of and do some either diagnostic or predictive types of analytics. Business people would want the insights that could be extracted from this data set to give a summary of how they're positioned in their community. And so it would really depend on, there's multiple use cases by multiple levels within both IT as well as clinical as well as business. So I think about this in those three tiers of technologists, clinicians, and business. At the center of all of those is kind of a new role that's sort of been evolving over the last 10 years called a health analyst. Many of you might equate this to what we used to have business analysts do, which is to look at data, write requirements, bring the business the clinical and the IT groups together in order to build product or write a specification, whatever you might want to do.
Okay. Interesting. You actually answered my next question as well. That was all encompassing. That was a good answer. Thank you.
So how often will the data need to be refreshed in the subscription service?
At a minimum, it needs to be refreshed annually. Quarterly is what the majority of the industry does a refresh on it today.
Okay, so you're going to get the information quarterly?
Yes.
Okay, so you want to publish it quarterly. Okay. And that's a reliable schedule, right? So it's like done on like a certain day of the month or something?
It was very reliable until last week. We hope it continues to be reliable.
Okay, yeah, maybe it has something to do with the CDC freeze on information. Who knows?
Yeah.
And then how much I mean, you're going to want to charge for a subscription. Are you going to offer an academic subscription, or are you just going to do like a flat fee?
Yeah, no, I've always been a pretty big fan of students and universities, and I do think there's a opportunity for students and universities to have a lower price subscription to the asset. And then on the business side, these subscriptions for this level of data are usually in the $199 to $299 per year type of range. It can go higher depending on the number of users that you have. So an HCA that might have 2,000 users, you'd want to charge significantly more than a critical access hospital that might only have one analyst who's accessing the data.
Is that similar to like Definitive or like one of these other sources?
Yeah, there's sort of a continuum of data analytics provider in the space. Definitive would be one of the higher priced providers, even though they have the same level of data as AHD, which is the American Hospital Directory out of Louisville. And so there is a pretty wide spectrum of the types of information that you want to make available and the pricing of that subscription.
Okay. Now, on the sample data that you sent me, it's the tables are somewhat fragmented, right? Would you see those like packaged in a different way? Maybe they're joined together by some common keys and presented as a single file, or are you thinking that they're okay in these disparate formats?
Yeah, so the individual tables all relate to a certain subject type. So there is the ability to string all of the tables together and create one long flat file, which is what I've historically done in the past on this file. There are elements of the table like financials that's the only thing that people care about. So they might not care about beds. They might not care about cost. They only want to know what the charges are. And so you can keep the tables together for segments, but historically we've strung them all together to create a longitudinal or a flat file that make the analytics a little easier to compare hospitals to one another, provider to one another.
All right, we'll look at that a bit more. Is there like a common key like ACN or?
There is. It's MPI.
NPI. Okay. All right.
Yeah.
So, all right. Yeah, we may have to do some mapping or something, but we'll figure it out.
If it's not MPI, the other number that's consistent on these files is the Medicare provider ID number. That's a 6-digit. The MPI is 10 digits. So we can look at the file and give you some guidance there. Okay.
Let's shift our discussion a little bit to the kind of like the end result of like what the system might look like, right? So we were initially discussed like having the information in some type of analytics system, but I started thinking about that a little bit, and I was thinking it might be a little discouraging for people who, like, let's say, you know, I'm a Tableau user and we put it in SAP Analytics Cloud format, right? You know, the user might be put off by that. So are you thinking that, you know, we would maybe have like kind of a Tableau sample dashboards, but they would also be able to download the data as well?
Yeah, I think there's a lot of analysts and IT users of the data who just want to have a flat file.
Yeah.
And so send me the text file. Executives in healthcare do not want flat files. They just want, give me a visual and let me pick a filter. And that filter might be orthopedics. And then I can see everybody in the marketplace doing XYZ orthopedics.
Okay.
Those are the two sort of audiences, either the analyst and raw data or the executives and a dashboard approach.
Okay. Yes. So maybe a couple of samples of dashboards and then raw download. Okay.
Yes.
Besides having fast access to your data and being able to download dashboards, do you envision any other capabilities this stripping site may use?
Like maybe like news feeds or pointers or the data sources or maybe a discussion area or any other things that you maybe thought of?
Yeah, so on the updates, there's an opportunity to provide news like this hospital changed their reporting of they've added 18 new beds, or they've gotten rid of 18 new beds, or they closed, right? All of which are pretty important triggers for the market to understand. Number two would be what a lot of people haven't done yet, is to start to run either predictive or even diagnostic analytics on the data to say, we are way underbedded in this particular geographical region. And it's an opportunity for somebody to come into that market because we don't have enough beds, we don't have enough physicians, costs are too high and people can't afford care. So using machine learning or some other predictive tools might be very interesting as well with this sort of level of data.
Okay.
Okay, that kind of overlaps some of my the question I had to finish off my portion, but if you know, aside from what you just answered, as a finished result, what would be, in a perfect world, this program, what would it do for you, SANAXS? What will it provide for the users? What will it fulfill for you as far as what you're looking to introduce with it?
I think it's sort of locked up into what we just talked about. So one would be a high level visualization of the data that would allow people to more effectively and efficiently manage their community healthcare assets. The second piece would be to open this data set up into the Gen AI world that we're in now. So whether it's sizing up a help desk that Corey might be using and knowing that I've got 14 hospitals in this city, I'm going to need, 25 agents to be able to take care of that, and or to use the data to train other models on. Those are the things I'd be looking to get out of an end product like this.
Okay.
Benny, you're on mute.
I'm sorry. Okay, thank you so much, Mr. Todd. We really appreciate your input and we look forward to helping you design a system that can accomplish your goals. And if you are open with it, we would like to take this information today, whatever we have learned, as an input to create a working prototype and demonstrate how SANAXS website could function. And I'm hoping I'm pronouncing it correct.
Yes, you are.
Okay, thank you so much.
So maybe we'll schedule a follow-up in a couple of weeks to show you some things. And if you're good with that, we will schedule a follow-up meeting.
Yes, that sounds great. Look forward to it.
Perfect. Very much appreciated, Todd.
Yeah, we really appreciate it.
All right, thank you.